Well, a new treatment can help reduce symptoms for people with movement disorders like Parkinson's disease.
It's fascinating. It's called deep brain stimulation, and it's being offered right here in our area. So we have Marshall Health neurosurgeon Heather Pinckard-Dover here to explain, and this is just incredible once our viewers see this video. But let's talk about the procedure, because it's called deep brain stimulation. So what is that for those who don't know?
Okay. Deep brain stimulation is an implant that we can place inside of the brain to provide electricity to interrupt the abnormal signals in the movement areas of the brain. And we use it for things such as Parkinson's disease, essential tremor, dystonia. It's even being researched in areas such as Tourette syndrome, Huntington's disease, depression, addiction, and OCD.
So this can treat a lot of different symptoms, different issues there. So talk about how DBS works, and are there any risks?
So DBS works by implanting a wire deep inside the brain, typically one on each side of the brain as if they're having bilateral symptoms, and then connects to a battery that goes underneath the skin like a pacemaker. And think of it like a pacemaker for the brain. It's providing electricity to interrupt those abnormal patterns of firing in the brain.
Oh, okay.
Creates, you know, the shaking that we see with Parkinson's. I mean, it's incredible when we get to this video, how you can see someone stop shaking. They're able to function again.
We've got it right there. So talk about this video, and what can someone expect when undergoing DBS surgery?
So the gentleman on the left has not had the device turned on yet. The one on the right has it turned on. He has bilateral implants, and you see that he's able to not shake. He's able to move more smoothly. We can actually see these changes during the surgery. So the surgery is typically done awake when we're implanting the brain wires, and it's one of the most fun operations that I do. Nobody believes me we're going to have fun in surgery, but we do. And so you're wide awake. There is a frame that I use that helps secure your head in place no matter how much they're shaking. Their head's stable for me. I'm able to implant the wire and provide a little bit of electricity, and we'll see that tremor stop. And then I'll turn it up until I start to see side effects, and that lets me know exactly where I'm at in the brain, and I can always move the wire if I need to make sure we're in the best possible spot. The surgery is done in 3 stages. One side of the brain wire, then you go to sleep, 2 extensions go down the neck and connect to the battery in the chest, and then the 3rd stage is to do the other side of the brain.
We're talking some serious areas. I mean, this is brain surgery. You're talking about neck, the chest. Obviously, somebody who's looking into this really needs it, but I'm sure that there's a fear there.
Right. Most people, they say, have to hear about it about 3 times before they're willing to undergo the surgery. The first time they're like, no way, I'm not bad enough. The second time they're like, no, I don't think I'm ready. By the 3rd time, their quality of life has gone so far down due to the disorder. They're like, okay, tell me about that thing again where you drill holes in my head. But it's actually a very well tolerated surgery, very low risk, about 1 in 200 risk of any kind of permanent neurologic deficit, 1 to 5% risk of having infection or bleeding issues.
Yeah, and we saw by that video, the one man, he could not control what his body was doing, but in the other side, he looked like he was getting back to having a normal life.
Yes, ma'am.
Fully functioning.
Amazing.
Talk about invisible DBS. What's that?
So there's several ways to do DBS. Most people implant the cap just on top of the skull. But where I trained, we use a special technique that I've adopted here where I drill a recession in the skull so that the cap actually sits down inside the skull, and when I close it, there's no bump or anything over there. If you've ever seen anybody with DBS, most likely you've seen that they have 2 little bumps in their hair. Kind of looks like sawed-off horns. I don't like that look. But also we did the research, and at where I trained, they'd done 1,700 patients, and several hundred of them were before they adopted this technique, several hundred after. And I presented in Barcelona that this actually reduces the risk of skin erosion long-term for patients.
It's incredible.
thank you for having this extra training, because that's amazing.
It's great
And
that
we can have this done right here for anyone who has a loved one who might need this. So if someone would like to get in touch with you in your department and find out more about it and see if they're a good candidate for it, what's the best way to do this?
They can give our office a call at 304-691-1787 or talk to your primary care doctor or neurologist, and they can always refer you over to Marshall Neuroscience, and we're happy to help.
It's incredible.
It's just amazing.
I know. I'm completely fascinated.
Yes.
Thank you, Dr. Dover, for being here. We really appreciate it.
Thank you very much.